Hey guys, so if you are studying for NCLEX or you know someone is studying for NCLEX, please send this to them. I have a list of topics that I would strongly encourage you to add to your list of topics that you really need to study and know well for this next generation NCLEX. And if anyone's taking their boards and there is something missing from the list that you feel should be added to the list, please, by all means, go ahead and put in the comment section, because we have one goal here, and that is to learn. So here are my topics that I strongly encourage you to make sure you know well in preparation for NCLEX. Here we go. I'm going to start with geriatric points. As you know, the geriatric population, they're living longer, all right? So you will get a good amount of questions on just the geriatric population. Just keep safety in mind. But when it comes to the geriatric population, medications start low and go slow. Why? They're at high risk for toxicity. Remember, they have decreased liver and kidney function, so the medications will stay in the system longer. Increased risk for falls. You got to remember, when it comes to older population, one of the first signs and symptoms of UTI that you're going to see is what? Confusion. Decreased sensory, so that's also going to be a safety issue. Make sure you know your eye disorders. Make sure you know your glaucoma, retinal detachment, cataracts, etc. Dehydration. Make sure you know the signs and symptoms of dehydration. Make sure you know those nursing interventions. Constipation. Make sure you know the teaching. You're going to get the patient to move around, drink lots of fluids. Make sure you know the nursing interventions for constipation, the types of foods that they need to eat. Make sure you know the signs and symptoms of medication toxicity, specifically insulin, digoxin. Hemorrhoids. Make sure you know the teaching for hemorrhoid prevention, treatment. Rheumatoid arthritis. Make sure you know the symptoms and nursing intervention. Osteoporosis. Don't forget the teaching for weight-bearing activities, exercises, foods high in calcium. Make sure you know the risk factors for osteoporosis, such as, the slim Asian woman, obesity, etc. Biophosphonates. Make sure you know about that medication. Make sure you know you got to take it on an empty stomach in the morning. You got to sit up for at least an hour. Can't lie down afterwards. Dementia versus delirium. Make sure you know the difference. General points. Oh, I'm going to go over my 3 minutes. Okay, anyway, dialysis. Make sure you know the foods to teach the patient to avoid. Polypharmacy. Skincare. Make sure you know the nursing interventions to prevent ulcers. Depression. Make sure you know your SSRI.